I'm Kristen Macurdy, founder of Guided Surrogacy Solutions. Thank you for tuning in for another episode of Journey Vision. With me today, we have Counseling with Joey and Associates to share more with us about mental health during the surrogacy journey. And with that, Joey, I'm going to go ahead and turn it to you for introductions.
Thank you. Well, Kristen, it's a pleasure. Thank you for having us on your podcast. So my name is Joey Guzman-Kuffel, and I'm a licensed marriage and family therapist. I've been working in mental health for over 11 years. And not only am I a therapist, but I'm also a two-time dad through surrogacy, as you know. So I've been through the surrogacy journey along with my husband and office manager, Rob. And our surrogacy journey is really what led us to start our private practice and specializing in helping others build their family. So adding the mental health component, helping educate around surrogacy. What is that journey? What does it look like? What are some of the things that they need to do to prepare for it? And so really our own journey is really what motivated us to branch out from working at a treatment center to starting our own private practice and helping others with the things that we felt that were lacking in our journey.
My name is Rob, and I am the office manager at Counseling with Joey, as Joey has already mentioned. I am also a father twice through surrogacy, as Joey mentioned, and we work together on a daily basis, which is something that not all couples enjoy, but we seem to enjoy it. I'm really enjoying being able to share our experience with others and help others build families. I think one of the going in arguments for us is that we wanted to focus on the people and on the family building piece less than on the profits. And that has made a huge difference for us.
Oh, wonderful. So I am Whittney Robertson. I am a licensed marriage and family therapist as well. I've been a therapist for about 8 years, but in the field for 3. I got into the field because I was well connected with Joey. So I got to the privilege of getting to learn about his surrogacy journey, or their surrogacy journey, I should say, and be a friend and a support through that. And then he brought me on so I could continue supporting other people navigating their journeys.
I love that. Thank you all for being here.
Well, thank you for having us.
Yeah, in sunny San Diego, and we're here because of the SEEDS conference. So
that's right.
We're very excited about that. And with that being said, Joey, you were actually on a panel
that is correct.
For the SEEDS conference. So can you tell us a little bit more about what you're hopeful for our surrogacy professionals? You know, there's over 300 surrogacy professionals that are attending this conference in San Diego. And really, what are you hopeful that they're going to take away from your panel?
Yeah, so I think the main thing is, how does the mental health component really just impact the overall surrogacy journey process? There's a medical component, there is a legal component, there's other components, but there's also mental health. And it really is such an important piece because that mental health aspect can really impact every part of the process. And so having education around how people can be affected, emotionally and psychologically, whether if you're a gestational carrier who is signing up to want to be a surrogate, an egg donor, a sperm donor, or just someone like ourselves who are intended parents, you don't know what you don't know. And so being able to get informed and receive education, psychoeducation around this process is really the biggest thing in this whole process. And so I think that anytime a mental health provider comes to SEEDS or on any panel, the hope is that what we're trying to convey really translates over so that we can be incorporating that mental health piece at every level.
I agree with that. So SEEDS is largely focused on the ethics of third-party reproduction. And with third-party reproduction, we don't want it just to be a very medical, cold-based dynamic. We want it to be relational. We want to recognize the humans that are involved in the process. And so speaking of the humanness, we need to speak to each person's framework, mental framework, and help everybody be well integrated through the process. So I think SEEDS provides an opportunity for more discussion, for unique dynamics, for everybody to share their story about what was effective, what wasn't effective in their journey, so that we can better prepare the future participants.
Yeah, I'm glad that you brought up that relational thing, because surrogacy is a relational experience. And so part of the relationship aspect brings in the mental health piece, like, right? Like, what is everybody's mind framework, right? Just like, expectations. And so if we're not talking about those things, then we're doing a disservice to anybody who comes to an agency or a mental health provider or an attorney when we're not educating them on the things that they need to be aware of.
Mm-hmm. And informed consent is a big part of this. You want to know what you're agreeing to, and you want to make sure that you have a voice to be able to speak to it. So I think that's the privilege of getting to go to the SEEDS conference, is to start having those discussions and help us prepare.
And we're so thankful for that. So you mentioned psychoeducational, and that's, one of the consults that really intended parents have throughout the process. And I think some intended parents, when they come into this process and they say, oh, you need to meet with a counselor or a therapist, in our agency, we do that prior to matching. They think, oh, is someone evaluating me to become a parent? And when I think back to my own surrogacy journey and our psychoeducational consult, it was nothing, no one was screening me, am I fit to be a parent? So can you share a little bit more with us in your sessions that you have with intended parents and even surrogates when you're pre-screening them for their psychosocial consults? What do you talk about in those sessions that's really important to prepare them for their surrogacy journey?
Great, Kristen. So there's a lot that we cover on both angles, both psychoeducational consultations for intended parents and also the psychosocial screening for surrogates, sperm donors, egg donors. And at the core, again, it's education, psychoeducation. So for an intended parent, we talk about different aspects about what their journey, can look like, and we educate around the differences between egg donors and sperm donors. What are the different classifications or categories? What does non-identified mean? What does non-identified with open identity release mean? So that they can become educated about what they're looking at when they're looking at profiles. When people are starting out, they don't know all of these things, and they just think, oh, there's this profile, okay, this is what we're going to go with, but they don't know what the implications are when they're not really putting a lot of thought into that process. And so we educate around what their options are, what the implications are when they're going to make their selections based on these things, right? And Whittney, you want to add on?
Yeah, I think a lot of it is about empowerment. We want them to take in the information, have time and space to talk about it with each other as a couple, so that when they are ready to move forward into matching with an egg donor or a surrogate, they know what they want to ask. They know what they are looking for and can ideally have healthy expectations for the process. Something I think you mentioned that I thought was very important is a lot of people show up to these meetings that have the expectation that they are being evaluated by us, and they're worried that we're going to pass fail them as parents, and that's really not how we approach our conversations with them. And I even note that in the very beginning is to settle that fear, that anxiety associated. We're not here to judge if you're going to be a great parent or not. We're here to make sure that you feel empowered to take the tools, to ask the right questions, and to move forward as you want this to be, with, of course, respect to the surrogate and the egg donors that are involved. So it's education and it's empowerment in my mind.
Yeah, a lot of times we get intended parents that call into the office, and I'll get the calls as the office manager, and they're asking that very question. What is this all about? Why do I have to do this? And the way I usually describe it is that a mental health professional is going to sit down with you for an hour and 15 minutes, and they're going to walk you through the typical IVF or surrogacy journey from beginning to end. And they're going to point out all the areas where you have to make decisions as the intended parents. And they're going to provide you with the data and the resources to make the best decisions possible for your family building experience. The other thing that the mental health professionals really do is point out areas where there can be problems and pitfalls, and help you to develop a strategy now in case you encounter any of those problems or pitfalls. You'll be better prepared. I think the whole experience is really about educating the intended parents and preparing them for the journey ahead.
Yeah. Get empowerment, informed consent, all of these things is what we're preparing them for in these psychoeducational consultations, so that they can make the best decisions for them and their family while understanding what it might look like, in the future.
Right, because as an intended parent in a surrogacy journey, there is a lot of where you feel like you are out of control. And how do you manage those expectations and maybe unspoken expectations in communicating what you hope the journey looks like with your gestational carrier? So,
And there can be consequences immediately, and then there's also future consequences, and it's important to keep in mind those future consequences.
It is interesting because, so we're providing education, but we're also like providing other types of scenarios, like hypothetical scenarios. Well, if you're going with this, what about when this happens, 20 years from now? And people are like, well, but it's too far away. I'm like, yes, it is. It's very far off. But how would you feel about that? Because this in the future is based on what you're deciding on now. And so we're kind of wanting to connect the future a little bit with the present so that, again, it gives them a wider view of what they're going to carry, for the rest of their lives. And it's not just about their lives, but the life of their potential child.
And why is that important?
The child piece?
Yes, yeah.
Because it is their experience too.
Absolutely.
And, we are making decisions about how we want to build our family. And it has an impact on the children that are being either born through donor conception or through surrogacy. There's nothing, there's nothing abnormal about that. It's just different from other people. And so we want to be able to educate the intended parents on what the children may experience so that they can also start to evaluate how they feel about it. Start to question, their ideas or beliefs around specific things, specifically when we're looking at like disclosure, transparency. How do you share this? Are you going to share it? Why are you not sharing it? And providing information about when you're not sharing things, like what does that communicate to your child? And what is their experience when you're not communicating this?
So I think we have certain topics that we address, but we also need to tailor it to the person that we're speaking with. So their emotions, their thoughts behind the process is largely going to impact their specific journey and their child. So if they're feeling uncomfortable about some element of their child's origin story, then that's going to get potentially relayed to the child one day, and their own narrative of identity formation in the future could be impacted if their parents aren't fully on board, aren't ready for having some of these discussions. So starting this early really helps not just the intended parents grow comfortable with what their plan is or their reproductive plan, but also them starting out a really strong, solid foundation for their child to grow confident and proud of their own personal origin story.
Yeah. And with that too, we're also looking at what the cultural piece is, or, because that also plays an impact when we're thinking about like their decision making around how they're going to select a donor, if they're going to have disclosure or not. And so we do our best to educate and take into consideration also what their tailored, situation is.
So we're talking about children and their story. What about gestational carriers and sharing that they're going to be a gestational carrier with their children? What are some tips or conversations that you have during their screenings for surrogacy? What are some ideas about how they can share with their child that, this is not our child. We're not taking this baby home, so that child can also be prepared and confident in their future as well.
I always start with where they're at. So when I meet with them, I start this discussion with, okay, have you told or have you disclosed with your own family members, your children, about the process? And I take it from where they're at. I do always encourage early transparency for their involvement, because we want to make sure the whole family unit is ready to go forward with this surrogacy journey. There's a lot of great children's books out there for them to utilize to have this conversation with children of younger ages. I feel like you could use books at any time, but especially for the younger children to help prepare them, because the message that we do want them to have is what you just said. This child's not coming home with us. We're doing this great gift for somebody else, and we're going to take care of this baby while the baby's in the womb. but then this baby's going to go home with the intended parents. And I think it also can be helpful for them to have the opportunity to meet the intended parents if that would be beneficial for the children as well. So it doesn't just take this abstract thought of surrogacy. It really helps to kind of solidify that this baby is going home with Joey and this baby's going home with Rob, and they are just such lovely people. I think that really is beneficial for children and helping them understand what their mom is doing.
Yeah, I was just gonna say, I'll never forget, our surrogate was pregnant with our second daughter, and they were out at a store with our surrogate's daughter, who was probably 4 or 5 at the time, and the clerk at the cash register said to the little girl, "Oh, I see you're going to have a little brother, little sister pretty soon." And she said, "Oh, no, that's not our baby. That mommy's going to give that baby to somebody else." And so the clerk was very confused, and so the surrogate had to kind of explain the situation. But it just goes to show what you were saying, that it's really important that they have that conversation early on.
Well, the thing too is that, as an individual, as an adult woman who wants to help somebody else grow their family, like they're making this decision, but their decision isn't just their decision. It's like their decision is going to impact their spouse, their children, everybody, right? So it's not just like, I want to help someone and this is the thing. Like, it's larger than that. And so I think that when you're thinking about wanting to become a surrogate, it's important to start like wrapping in the people that are in your family, to start talking about your thoughts, what you're planning to do, or and gathering their feedback. And I think that children are never too young to like be involved in that process. And it's just knowing how do you start having those conversations. And I think, Whittney, you mentioned that, yes, there's a lot of amazing books nowadays that facilitate that disclosure process, that conversation that you can have with your kids by introducing these books. And so we also, in our psychosocial screenings, we also talk about, or I talk about, the intended parent piece, right? Like allowing the children to have eyes on where the baby is going to go, because this emotionally and psychologically also gives them that thing of like, oh, so we're not keeping the baby. Those are the parents. And then all of a sudden in their mind, they start to structure in the idea like, oh, those are the parents and that's where the babies are going to go to. It makes it easier for them to understand really what's going on.
Mm-hmm.
So you talk about having the surrogate having these conversations early on and including all of the family. What happens when they share their idea with maybe their spouse or partner, and the spouse and partner isn't on board as maybe she is?
Mm-hmm. That's a hard one. That's a really hard one. And so I think that if that would be the case, maybe you want to kind of sit and reflect a little bit about what's going on. I think maybe the surrogate might want to have more conversations with her spouse about, what this is. Because a lot of the times the spouses may not know really what surrogacy is. And I think in a lot of the evaluations that I've sat in, there's been many instances where the spouse or the partner, when I ask them what their thoughts are about surrogacy or what's their motivation, for supporting the surrogate in this process. And the first thing that they'll say is like, well, first I wasn't on board. I didn't know what this was. I thought that, she was just going to give our baby away or something like that. Right. So it's just really, again, providing education to the spouse or the significant other so that they understand what surrogacy is. Because I think a lot of the times the surrogate or the surrogate candidate has already been thinking about it for a while. She's already been like researching or finding things on social media. And so she's following stories. So she's already kind of developed like, oh, this sense of like, this is what I really want to do. While the spouse is in the dark. And I've had evaluations where the spouse is like, I don't even know what this is. And they're already being evaluated. They're sitting down with me and they had no clue as to what this process was, what did it mean, or what was the requirements, or how much the time commitment was.
I think with any life event, if you introduce it for the first time, people need space to process it. And so by saying, I want to commit myself to 9-10 months, maybe more, and having that be a first introduction, people might be a little taken aback. They might be confused. They might not know the process. And given the history of surrogacy, a lot of people refer to the gestational surrogacy. They believe it is traditional surrogacy when they come to these meetings. So they do think this is going to be your egg, your body carrying it, and therefore our child. And so their expectations do have to be adjusted to understand what this gestational surrogacy really is going to entail. And so I think that given time and education and resources, oftentimes they do come around to understand and be supportive. Similar to Joey's experience, people do show up to the meetings and will say, well, at first I had lots of questions, or at first I was concerned, but after talking with my partner, after talking with others, I'm on board now. I'm ready to support them. So I think it's, if your partner is having some challenges coming on board with surrogacy, give them time to talk about it with you, allow them to space to research, and then come back to that conversation and see how everybody's feeling.
And I think it would be a great idea for anybody who's listening to us or watching us, if you're considering surrogacy and you know that your significant other might not be on board, maybe this is the time where you can go to speak to a therapist to kind of walk you through what the steps are and allow both parties to process what it might be like for them, so that they both can understand their point of view and maybe get to a point where they're healthy enough in their relationship and their thought process to say, okay, we're both on board. Let's go over to guided surrogacy solutions and apply for, surrogacy.
Mm-hmm.
Yeah. And we have had cases before where maybe the husband wasn't on board or really didn't understand everything that it entailed. And they did. They paused. They went to counseling together, talked through some things, came back, and then had their session again and felt more educated, more prepared to say, yes, we are fully committed to this process. Mm-hmm. And so, I think as gestational carrier applicants, they're doing all the research. They're on different social media platforms, but for spouses and partners, sometimes they're just hearing it directly, from their spouse or partner. And I think the more resources we can give them. So, one of the things that we do as an agency is we sit down with the spouses and we have a conversation with them, with the surrogate. And we say, hey, this is where we're at so far in the process. These are the next steps prior to you being matched. How are you feeling about this? What questions do you have for us that we can help you answer? And sometimes they have a lot and sometimes they don't have any. And they're like, this is her decision. I'm fully going to support her. But that still makes us a little nervous because we want them to have questions, and they should have questions because this is a long process and this is sometimes it's also very new for them. So we try to have that session with them.
That's so smart, because it's really important that the spouse be there. I mean, for that time when the surrogate is pregnant, they're going to need a support system. They're not going to be able to have the same life that they had beforehand, and the spouse is going to play a big role in that support system.
Yeah. And it's going to be a different experience because while they've experienced pregnancy together, this isn't that same pregnancy experience. I think one of the things that also when it comes to psychoeducation during these evaluations is like, this isn't going to be the same experience that you had before. There might not be a lot of celebration for you because when you're pregnant with your own child, you're getting acknowledged, you're getting all the attention. It's about you, the baby's coming home, there's a baby shower, there's all of these things. And when you're doing surrogacy, it may not be that. So when people are trying to celebrate, you're going to say, oh, but it's not my baby, right? So it's different. And so can that potentially impact the surrogate's, mental health in that way where she feels, because I've met with many surrogates who have shared that, it feels isolating for them once they go on the surrogacy journey because they're not getting that full experience that they did with their own pregnancy. And if the spouse isn't really on board or they're not there, she's gonna feel even lonelier, and that can impact the overall mental health of the surrogate. So we really want to make sure that the spouse or significant other understands what this process is. So mental health psychoeducation for the significant other and spouse is highly important on the agency level as it is with the mental health, that we provide enough information, enough hypothetical scenarios so that they understand this is a possibility. Do you understand what that means? And what do you think about that? So that, as us as mental health providers, we can get as much as a clear picture as we can get about where they're at.
And when you talk about this is going to be different than before, a lot of these surrogates, they've had no problems with prior pregnancy, right? Typically there's no complications with prior pregnancies. They have not had a difficult time getting pregnant. So we talk to them, how are you going to feel if the embryo transfer is not successful or you do have a miscarriage? So can you share a little bit more with us about, how we talk through those hypothetical situations and how we can support both the surrogate and the intended parents when the transfer maybe is unsuccessful or there is a miscarriage, because there's definitely emotions on both sides of those, and they're typically very different.
So how we can support both parties with something like a unsuccessful transfer or miscarriage or something like that. This goes to something that's already within the ASRM guidelines, which is joint sessions. These are so important because it gives the mental health providers and the intended parents and the surrogate an opportunity to come together to talk about what this might be like. We bring up some really difficult hypothetical scenarios to see how both parties feel, and not so that we can just see how they feel or what they're thinking, but they get to understand what each other are thinking and what each other are feeling. Because when you go through that initial screening process or matching process, we get an hour and a half of speaking with the surrogate, and then our agency asks us, do you want to work with her, right? So that's like the first, the fastest date ever that you're ever going to have. It's like speed dating. You have to decide right away, do you want to marry this person for those 10, 11 months or whatever it may be, right? And so, but you don't know anything about them and other than whatever you're addressing in that match meeting. So that joint session gives you almost like that second date to let's just check in to see, are we really on the same page, and did we miss anything during the first interview? And for us, we kind of we go in, and by asking specific things that they may have not addressed in their own individual sessions, to give them that opportunity to look at something different, and to understand, is this going to be a right fit for us after all? One thing that we ask is, if there is an unsuccessful transfer, if you have a miscarriage, how do you both want to be supported by one another? Because in most of my experience, surrogates sometimes will withdraw from the intended parents, and the intended parents withdraw from the surrogate because they're both going through their own experience, their own feelings, and it's so awkward to even address what's going on, right? So, but you're in a relationship, if you just don't walk away from something like that. It's something that has happened, like a loss. So it's important to understand, how does this surrogate want to be supported by the intended parents? How do the intended parents want to be supported by the surrogate in these situations? And so we kind of put them on the spot with this scenario, and now let's kind of hear it out. And now we can formulate a plan so that you have something in place if something like this were to occur.
Yeah, more and more agencies and clinics now are taking those joint sessions on board and asking their surrogates and intended parents to have them. We've seen a significant uptick in those. And when we had our first child, 5 years ago, it wasn't that big of a deal. And I don't think we had a joint session with our surrogate. We
never did.
Yeah.
But I think it also just depends where we're at in the country. I think, I think in our experience, a lot of clinics and agencies who are on the East Coast, would be performing these joint sessions compared to the clinics and agencies that we work with who are on the West Coast. I think had to do that, but I think everybody's catching up on that because they are important. They're important for a reason. I think these types of joint sessions also reduce any type of distress to the main parties, the surrogate and the intended parents, as well as the agency and the clinic and everybody else involved.
I agree fully. I love the joint sessions for that reason, because it really highlights what everybody needs out of this journey, especially in terms of support. I think even beyond that, it allows you to be introspective with yourself, very self-aware about what you think you might need in the event that you face a situation like this. And I think that's also room for discussion. Is yes, we don't know how you will respond in the moment if you've had very successful pregnancies in the past. But in the event this does happen, what is your natural intuition? What do you think is going to happen? How have you responded to hardships in the past? And can we use the coping skills that were beneficial for you previously for this journey? Or do we need to help teach you some new coping skills to help balance your understanding of what it might mean to face a complication in a pregnancy? And so it gives or opens up space for us to have those discussions and teach them some coping skills.
I love that. And I think that, we personally had a group session prior to our surrogacy journey. Although I really can't remember much of it at the time, I know that we did have it, and the clinic is the one who actually conducted that session. So, from the East Coast perspective, I think that we definitely do work with some clinics who say, you know what, regardless if the agency pre-screened the surrogate and completed the psychosocial, we're still going to do it in clinic, and we're also going to have the group session at the clinic also. So, I think we see a variety of really from the East Coast what clinics' expectations are for conducting those sessions. I just lost my train of thought about the question that I wanted to ask, because we've been just talking so much. So we're talking about, the three main sessions, the psychoeducational, psychosocial, and the group. And that's really all before transfer. So how can we continue to still support our intended parents and surrogates afterwards? What are some things that, as counselors, that you can help do to support them? Or, I think sometimes people have this stigma, oh, counseling, oh, well, wait, there's nothing wrong with me. I'm fine. I'll get through this, and we do see situations that happen and are unpredictable that, maybe have never even happened in a surrogacy journey before, that an agency has had, or never happened in their own pregnancy, and they do need that support. So what can we offer our surrogates and intended parents in those types of situations?
I think the best thing is that, a continuation of follow-up support sessions or check-in support sessions. There's some facilities that we work with that might have like milestone check-ins just to make sure, like, where are you at? How are you feeling? Just to do like a wellness check, so to speak. And I think that would be important if we can all just include that mental health aspect again throughout the whole journey, because it almost seems like, we go through our psychoeducation, our screenings, and then that's it.
Yeah.
And now like you're on your own, but there's more than that.
Absolutely.
I mean, there's so much more. And both of our journeys were not free from bumps. I mean, they were very challenging. I remember one time I was in a parking lot just like crying because we had just learned that, because we were pregnant with triplets for our first journey. And two of our babies, they did not make it. And there I was in the parking lot crying and hysterically and not knowing like what to do. Luckily, I had my support person, my best friend, who I called, and that was really helpful. But it would be nice that we don't just do these initial mental health aspects and then just kind of like, okay, that's it.
Right.
I think it's just like a longer journey. And even if people are feeling that it's going great and they don't need it, okay. But it's there, it's available so that you can speak to someone. And I think that is something that might be important for just as a whole, for the whole field to just kind of incorporate.
The other thing that Joey and Whittney have both done is lead surrogate support group meetings. So a group of surrogates from various locations will meet on a video teleconference platform, and they'll have a group meeting that's kind of facilitated by one of the counselors. And they'll talk about some of the issues that the surrogates are going through. And then for us as intended parents, there's a number of support groups out there. I know one of the things early on that we did was find other fathers that were having or either having children through surrogacy or had children through surrogacy. And we befriended them and talked with them and learned from them. So I think finding peers that are in a similar situation is very helpful.
But also, it's not easy to find, these groups. Like it's like they're very limited, or just kind of there's not a lot of them, and not all agencies, offer them. So one of the things that we do in our practice is that we really load them up with resources. So whatever we know, we give it to them. Here's this one resource for a support group. Here's another one. Here's another. If this one doesn't work, try this one. So we try to do our best to send them off with some like goodies. Like, you can use this throughout your whole journey. It's up to you how you use it, but here it is.
I'm a strong proponent of therapy, obviously, of being a therapist, so I'm a little biased with this, but I feel like therapy, you don't have to come with something being wrong with you.
Yeah.
You are welcome to come to just explore whatever is on your mind. And so these support sessions, support groups can be on a regular basis. They can be as needed as you're going through a journey. If you want to share in the excitement of a journey, if you want to share in a hardship with somebody, there's an avenue to do that. Not just in counseling, though. I personally love to see it when they come back and they say, oh, my coordinator was so great, or my agency has been so helpful for me to have conversations. So I think the support doesn't just have to be in therapy, though I love therapy. I think it can be with their other support network, including the agency coordinators, including potentially the intended parents or the surrogate in their dynamic, or family and friends.
You know, when you talk about your surrogacy journey, definitely had bumps. I always tell my clients, I said, our theme song for our surrogacy journey was Taylor Swift, Are We Out of the Woods Yet? Right? It's like, okay, now this is going to happen. Okay, now we have to like wait. And it's like, okay, can we move forward? And it's like, I feel like a lot of times people are holding their breath to get to the next milestone. In my own personal journey, I did not show any emotion until induction day.
Oh, wow.
I held back everything. Not gratitude, but like just, you know, I didn't shed any tears. I never wanted our surrogate to see that until induction day. And she said to me, oh, now you're finally crying. And I was like, I'm not a heartless person, but I always was just protecting myself from something bad happening. And so as intended parents, you know, sometimes we really do feel out of control. And even, you know, a story that I share is that, and this is ridiculous, but they wanted to schedule her for an induction. And I said, well, if that's the induction day, then he won't be a Libra. And I really want him to be a Libra because I'm a Libra. And she was like, okay, well, let me call them back. But I didn't know as she was in her car crying over that. And that's something she shared with me afterwards. My son was born on his induction day that they had scheduled. He is not a Libra, and I'm happy to report that he is absolutely fine, right? So, like, that's the ridiculousness sometimes that we just, like, cling on to this, like, having control of something.
Yeah.
So what you talked about, coping skills also. So like, what are some coping skills that intended parents can use when they are feeling out of control? Yeah.
Well, I think the first thing is you want to acknowledge that you're feeling like things are out of your control, because there is a lack of control. There is a lack of control for intended parents. And I also have to say there's a lack of control for the surrogate as well. Like, you both are experiencing this lack of control, but it's important to acknowledge your feelings to yourself out loud if you want to write it out, because your feelings are valid and what you're experiencing is valid. So being able to acknowledge that. And then after that, I think it's really about, you know, understanding, okay, why are you feeling that way? So what are you telling yourself about the journey that makes you feel like it's out of control? And maybe kind of honing in on like the circle of control, like what are the things that you can't control within the chaos that you feel like you can't control? Because maybe that's something you can focus on that can help you reduce anxiety. Is like, okay, I can't do anything about this, and acknowledging that you can't do anything about that, but there is something I could do about this thing, and maybe that could be one of the things that you can hone in on to feel like you have that control, right? I mean, what are some other things that we can...
I'm going to throw us back. I don't know if you remember this. Early in our training days, we got this quote, you have to name it to tame it.
Yes.
And so that's a mentality I like to use a lot. Whereas if you're harboring all this in your own thoughts, you tend to overthink it. You're going to be having a lot of emotions. You're going to be pushing it down. And it's going to come out eventually. And maybe not in the healthiest of ways. So I feel like it's better if the thought comes up, it's better to share it, to put it out there in the world for somebody to respond to. So like a silly example of this is if I were to say, don't think about a polar bear, everybody's going to start thinking about polar bears. And the more that you try not to think about the polar bear, the more you're going to think about it. So it's better to just say, oh, okay, I'm thinking about a polar bear, talk it through, and then you'll get past thinking about the polar bears. So similar to any anxieties of a surrogacy journey, if you're trying to harbor it inside only and not name it, that can be really detrimental to your own health. So it's better to just put it out there for somebody to hear and process it with you. So I think that can be really helpful.
Yeah. And going back to, I think we've kind of named a little bit about support. Like,
Yes.
It is important to have a support system in place, right? You can't do this by yourself. There's going to be a lot that's going to come up for you. So you want to be able to name it. Name it to your husband, name it to your wife, name it to your support person or to your other friends. Like, in that moment when I was crying in that parking lot, like I was feeling it all, and I just was like, okay, I'm gonna name it. I have to name this. And so once I was talking to my friend and telling her all of the things that I was feeling and why I was feeling that way, it's like you take off a big load and you can breathe again. So having people that you can go to speak about your experience is really important. Another thing, and this goes further into like almost like CBT or stuff like that, cognitive behavioral therapy, is just like thinking, also like, and this was one saying that I kept from our training was like, if you change the way how you think, you'll change the way how you feel. And so it all starts again with, what is our narrative? Why are we telling ourselves that, that we don't have control? Right? But if you start thinking about or reframing your thought process to, I don't have control, to, well, I do have control of this, then again, it will reduce your anxiety and you might feel a lot better. And so therefore your behavior is going to be better, right? I do provide some of this education with intended parents when I'm speaking to them, because I know it can be really hard to not have control. And what we don't want is for them to also strain their relationship with the surrogate, because maybe they're being too overbearing, they're micromanaging, or they're overstepping boundaries. So giving them some tools about like, it really starts with how you're thinking about things. And you want to be mindful of what your behavior is when you're not paying attention to your thoughts that influence your feelings, that then influence your behavior.
Even further than that, coping looks different for everybody.
Right.
So if I enjoy exercise, somebody else might hate exercise, and that wouldn't be beneficial for them. And I also encourage people to think about the time of day. So sometimes exercise can be great during the daytime, but am I going to go on a run in the middle of the night because I woke up anxious? No. So you have to think about what coping looks like for you throughout the entire day. What's beneficial at one point, or for somebody might not be the same or true for you.
Yeah, and also disconnecting. It's okay to disconnect. It's okay to give yourself permission to be, I'm not going to think about surrogacy today. I'm not going to think about the pregnancy today. I'm not going to think about the transfer today. Today, I'm just going to go and just either be in my room and binge out on Netflix, or hang out with my friends, go have a margarita, or just go shopping, whatever you want, but it's okay to take care of yourself. And I feel like we humans find that hard to do.
Because
but
we're so focused on it. And when you said disconnect, at first I thought, oh, disconnect from social media, but that's also probably part of it too, because
Absolutely.
we can just read so much on social media and these Facebook groups and whatnot, and hear things and think, oh my gosh, what about this and what about this? So I think that disconnect is very important.
Yeah, social media is, I think, a big thing that adds on to our anxieties, because all we see there are the happy families and the people who are just posting that they gave birth and all of these things, and that could add on a lot to your anxiety or any depressive symptom that you may be going through. So disconnecting can also be disconnect from social media. It's okay, it'll be there. Like, once you're done with your journey, so giving yourself permission, like yourself permission is important.
So 2 key words I heard us say a lot is support and then relationships. So when we've talked a lot about before the journey and during the journey. What about after the journey? That postpartum support for the surrogate, and also with the intended parents now having a baby or babies at home. How can we continue to support? What do their relationship dynamics look like also?
I think this goes back to just the beginning too, is like you're setting expectations, right? In our psychoeducation, both with the surrogate and the intended parents, we talk about what does life look like after the surrogacy journey? How do you want your relationship to look like after the journey? Have you guys talked about this in, in your match meetings, or have you had like what have you, talked about in terms of what that looks like, so people can prepare for that? Now, at the SEEDS conference, there's going to be a topic on the fourth trimester, which I'm very excited to hear about there, because no one talks about the fourth trimester, right? And so there's like another period that is so important and crucial for the surrogate in terms of what life and recovery looks like after the surrogacy journey. And also, I guess, even for the intended parents, like, adapting to having a child. And there's other things that, that intended parents can go through. One of the things that we talk about too is like non-gestational postpartum. Specifically for all people, but I hone in very much on like men, because men think that you can't experience that, and you can. And I'm one of them who experienced that, and it's so real, but it's not talked about. There's not a lot of research on it either. But understanding that anyone who has not carried a child, who has a child, can experience depression, anxiety, and your mental health can also be affected. So support again, and I don't know what agencies. I know that there's some agencies that they have incorporated a fourth trimester program, which I think is fantastic. But again, utilizing us mental health providers to collaborate with agencies to come in and support people after the journey, I think is key.
I'll go back to what Whittney said earlier, where she said everybody is different, and so I think that relationship after the birth is different for every surrogate and intended parent pairing. For us, with our surrogate, I mean, we have a fantastic relationship. Even today, we're still getting text messages from her.
Yeah, I just texted her yesterday.
Yeah. and so for many folks, that friendship goes on for forever, and they're a family member for us now. But that's not the case with every situation.
Yeah, and again, understanding what are the expectations at the beginning, and the dynamic can shift and change throughout the journey, but still having that line, the open lines of communication, and understanding, are things shifting? Are they not shifting? Where are we still on the same page? Again, just like any relationship, you want to be checking in with your partner to see where you're at. I think that is so important to understand what does the relationship look like after this journey. And I think a lot of intended parents that I've met with has this concern of like, I don't want her to be like another parent, I don't want her to, be at our Christmas dinner and all our vacations. And I'm like, I don't think that's how it looks like. I think she has her own family and she has other priorities as well. So it doesn't have to, it can't be like that if that's what you want, but that's normally not the norm. It's not typical. And so, our surrogate had our first daughter 5 years ago, and, we check in on each other. Like, we text, but that's how it goes. She lives in another state. So we understand that, that we're not going to be at each other's holidays or banquets or whatever it is, but it works for us, and it's amazing.
Yeah. I mean, even our surrogate lives in the same state, and we don't get together for holidays or birthdays, but we are still 7 years later, still checking in, maybe not as much as we did when my son was first born and he was really cute and doing new things all the time. But we are still checking in on a regular basis. And so, I just think those relationship dynamics postpartum, they're unique to each journey.
Absolutely.
So, and just talking about that up front, what everyone hopes, is probably key. And letting that just develop organically.
And as you're mentioning that, things are unique to every journey, I think that when we go back to social media and we're not disconnected and we're looking at everybody else's journey, and remember, her journey is not your journey, and it could be very different. It may be educational depending on where you get the information from, but that's not going to happen to you. It may not be the thing that's going to happen to them. So not comparing, I think, is important.
No two journeys are the same.
No. Surrogacy is not cookie cutter. No. So before we close out, is there anything more that you want to talk about? Questions, take-home message for anyone?
Has it already been an hour?
Yeah, pretty much. I'm getting the time. I'm getting the.
We could talk about this.
I know all day long. There are so many things going on in my head right now, but
yeah. So the message that people can take is that
take home message.
Yeah, I think if you're considering being someone who wants to help build their family, a surrogate, a sperm donor, egg donor, or if you're someone who wants to build your family through surrogacy or an alternate, way, acknowledging your grief, your loss, whatever it is that you have been through is so important. And also just understanding that this journey can be long. And so we want to understand what patience is and become friends with patience, because we really need a lot of that. Yeah. So trying to be patient, being gentle to yourself, being kind to your partner, and just really, allowing yourself to disconnect when you have to. And that means social media, that means whatever you feel that you need to break from, it is okay. You're entitled to that.
Yeah, I would say for intended parents specifically, this is one of the most challenging times of their life if they're going through IVF or surrogacy. It's a huge expense. There's lawyers involved. There can be a lot of stress. And who better to help you with that than a mental health professional? Why not seek out the expertise of someone that can really help you on this journey?
Those are tough ones to follow. I agree with what they said, what they shared. And I think I go back to something that was mentioned at the very beginning, in that this is a human experience. And so it's okay to show up as yourself, who you are, and to recognize the humanness in others. So give each other grace, give yourself grace as you navigate this journey ahead.
Absolutely.
I love that. This has been so helpful, and I'm just so thankful that you were able to join us today for this session. So thank you all for being here.
Thank you so much for having
us.
us.
It's so exciting.